I feel better today than I felt in 8 years.
Tell me, where are you from?
From Los Angeles. Man, I've been dealing with TMJ, face tension, all interrelated issues with this TMJ grinding, clenching stuff for about 8 years. And I've gone through the gambit of, ENTs, oral surgeons, neuromuscular dentists, TMJ specialists, chiro, acupuncture.
Neurologist?
Did neurologist once. They kind of ruled out things, whatever they were checking for. When I came across your stuff, I was like, I wish I would have came across you 8 years ago. I wish I would have came to you first.
I was just barely doing this stuff then.
Yeah.
And we weren't looking at imaging, we weren't looking at joints yet.
Mm-hmm.
That was like caveman.
Yeah.
Caveman Dr. Nick.
And it was so funny. Another thing, the first neuromuscular dentist I saw back in 2012, the first guy that gave me a lower appliance. I went back to go see him just for a regular checkup probably about a year ago, and he was like, "Hey man, we got some new technology that I came across, the T-scan. I'm just now learning about the T-scan, and yeah, I know what we did back then was, back then." And it just goes to show, like, it was so much hit and miss with all these other dentists and so-called TMJ specialists.
We looked at joints, sympathetics, trigeminal inputs, cervical stuff. You understand all that because you've been through the screening.
Yeah.
Describe to us the neck blocks when we were diagnosing you. What was that? What did that tell you?
For the neck blocks, the main thing with the neck block, I did feel the sense of relaxation and, the neck, shoulders, so on and so forth. And I guess, in a way, like the best description you gave was it's kind of like walking to a room with a whole bunch of, different boom boxes, and now you kind of turn down the volume on one. Now you can kind of pick up on the others. The one main issue I've had that's kind of been like the most maddening thing has been the ringing in the ears, the tinnitus, and that came about with the clenching. And I think
8 years ago.
Yeah, 8 years ago. So it was trying to rule out, okay, is that from the cervical input or is that the trigeminal end?
Or the sympathetic.
Or the sympathetic, right.
And you were a decent candidate for the bite adjustment stuff.
Yeah.
So we've done you a couple hours ago.
Mm-hmm.
You went, you left, you got some lunch, you grabbed some lunch.
Mm-hmm.
What's it like? What's it like compared to, say, last week, last month to now? So far I'm feeling a lot of relaxation in my face. The facial tension is starting to dissipate. Yeah.
Since we did the procedure, I'm getting more range of motion, and it's kind of tripping me out, honestly. Like when I go to do it, I'm feeling an increased range of motion that I haven't been expecting.
See, here's the thing with you. We already have scans. We have the MRI data, so we know the disc isn't blocking you from opening.
Yeah.
Okay, so this means you had dystonia. You had bad muscle tone.
Yes.
The thing was worked up, and the brain didn't like what was going on. The muscle's working too hard to try to correct it, and it's spastic all the time, and it was wound up, and it wouldn't open all the way. So now all of a sudden you can open like a monster, right?
Yeah. Yeah.
So that's happened just since this morning.
Yes, absolutely.
That's huge.
It's very huge, and just that feeling in and of itself has been something I've been trying to get back to. Like it's starting to, I don't know, it's releasing in a way that it hasn't ever released before.
In the last 8 years.
Yeah. See, when you brought in that sympathetic aspect, that was something that was important, that no one else has really brought up. But I do feel like my system is ramping down little by little.
It's like it's chilling a little bit.
Like it is a little bit.
Less fight or flight, more rest and digest.
Absolutely. And that in and of itself was like one of those symptoms of this condition that was just driving me crazy.
Now let's talk about how's the bite feel after the bite adjustment.
The bite, at first it took some getting used to because I was so on the back teeth.
Yeah.
And that I used to think that was normal.
Yep.
Me being on the back teeth all the time was like normal. And now kind of having that balance towards the front.
Yep.
What I've been sensing, and it's been interesting, I've been feeling the face muscles relax a lot more.
Yeah.
And it just kind of revalidated for me that
something's changing.
That this getting balanced and these muscles starting to act right is
Affecting the
having
whole
this,
body.
is affecting this whole cranial sacral relation. Like it's
It's kind of crazy, isn't it?
it truly is. Yeah, but nothing, and that was always my frustration with that. Was like, how are you measuring this? You know, it's just like it's all subjective, and you're just.
Bingo.
And then the other frustration, like for me at that time, stuff was so tight and so just out of sync that I couldn't even keep myself oriented to what my home bite was.
Didn't have a home, did
I
you?
didn't have a home, so it's like you're trying to adjust.
You have a home now.
Yeah, I can feel
So
it
when you
now.
bite down, it lands in a place.
It does. It lands in a place, and when I'm there in that place, it's funny. I can feel things kind of start to relax.
Glad you had it done?
Absolutely.
Yeah.
Absolutely.
Any advice for other people?
I fully recommend anyone that's dealing with these issues with TMJ, TMD. There's a gambit of other things that come about from this that you definitely look into Dr. Nick, because I kid you not, just the screening in and of itself was very, very educational, because like you said, understanding that like the hinges is like the airplane wing. They have to be stable and adapted. And if that is off, then of course this is going to be off. And there hasn't been any other dentist or oral surgeon, neuromuscular dentist, TMJ specialist that I've seen that's looked at that.
They don't look at MRIs. They don't understand the soft tissue. They know it's there, but they ignore it.
They do.
Yeah, we're all taught that it's okay to ignore it.
Yeah.
And it's not okay to ignore it.
Nah,
You got to
it's
measure
not.
it.
I feel better today than I felt in 8 years. Honestly, I've tried.
So you're glad you had it done?
Yes.
Yeah.
So glad. Absolutely.
All right. Excellent. Thank you, man.
No problem. No, thank you.